For as long as the tired, poor, huddled masses yearning to be free have been arriving on our shores, the United States has been, well, making them sick. Here's the story of how migrating to America can be bad for your health in 3 minutes. 1607. England's first immigrants set up shop in Jamestown, Virginia, and drink from the salty James River. Many fall ill with typhoid, dysentery, and salt poisoning. Hundreds die. About 100 years later, immigrants from Europe bring one of the first foreign diseases to the New World, smallpox. The virus kills some 27,000 Native Americans. Flash forward to New York, 1832. Cholera quickly spreads through the city. The rich flee, but the poor stay at home. Many are Irish and Eastern European Jewish immigrants living in close quarters with no ventilation. By 1850, more than 5,000 are dead. The bright side? Cities begin providing residents with clean water. A century later, a study of mental patients concludes that if you're Norwegian, moving to America leads to increased psychosis. In short, the stress of immigrating to the US can, drive you crazy? Or, as the study suggests, maybe folks susceptible to psychosis are just drawn to the States. Scientists throughout the 1970s find that Japanese men living in Hawaii and California suffer from increased rates of heart disease compared to their kin back home. Docs say U.S. culture, in other words, fatty American foods, are to blame. In the mid-'80s, scientists discover that, after a decade stateside, women from China, Japan, and the Philippines face an 80% higher risk for breast cancer than women in their home countries, and it only increases generation to generation. However, coming to America might save you from other types of cancer. Japanese and Chinese immigrants in the U.S. have lower rates of stomach cancer than people back home. The American diet, with less salt and nitrates than in Asia, could be the reason. That's one point for the American diet, but recent studies show that the longer an immigrant stays in the U.S., the more likely it is he or she will gain weight. A lot of weight. Only 8% of immigrants living in the U.S. for less than a year are obese, compared to 19% of immigrants after 15 years. The typical male immigrant is 11 pounds heavier than counterparts in his homeland. The numbers are even worse for Mexican immigrants. When they first enter the U.S., the typical Mexican immigrant has better odds of staying leaner than the typical American. But after 15 years, more than half of Mexican-born women in the States are obese. And then there's diabetes. While 2% of Mexican arrivals have diabetes, that rises to 12% for those in the country a decade or longer. Meanwhile, only about 7% of U.S.-born Americans suffer from the disease. Doctors point to poor eating habits combined with little or no access to healthcare as the trigger. Of course, the story of American immigration is not all death and disease. Moving to the United States has given countless immigrants access to better paying jobs, freedom of religion, more opportunity for their children, and, as it turns out these days, thousands of fast food restaurants to choose from.